Insurance for everyone. That's what Donald Trump says. He says everybody will be beautifully covered. It's such a great Trumpism. So with those words in a Washington Post interview about the healthcare reform, repeal, replace, President-elect has raised a very fundamental question. Not just what will the new healthcare law look like, but what kind of Republican president is he going to be, and how much will he be at odds with what I'll call the Paul Ryan wing of the Republican Party? Now, I said this over and over again during the campaign when too many journalists tried to put Donald Trump into a box. He is not a traditional Republican. He takes some positions that are more in line with the Democratic Party, or a kind of a mixture of both parties. So, for example, Trump said over and over and over again, including in an interview with me, that he wanted no cuts whatsoever to Medicare. That's not the Paul Ryan position, which is that entitlement costs are out of control and we must do something to rein them in. And so now that the GOP has now taken over the House and Senate with a GOP president who will be sworn in on Friday, they are ready to move quickly on the repeal part of Obamacare, but not kind of at odds on the replace part. So here's the problem. This was always sort of a built-in time bomb when Barack Obama and the Democrats were able to pass their Affordable Care Act, which is you have 20 million people who now have insurance who potentially could lose it if you just got rid of the program and didn't replace it with anything. So along comes the new president and says, we will have a new system, it will be more simplified, the cost will be cheaper, and he sort of suggests to the Washington Post that if the House Republicans don't go along, he will use his influence. Referring to the little incident that happened the very first day of the new Congress when the House GOP caucus decided to try to get rid of that independent government ethics office, and Trump tweeted that this was a bad idea, and there was an uproar in the media, and of course they did a flip-flop. So we're going to see a real clash here, because are we talking here about access to health care or actual insurance that would cover those 20 million people? Will their benefits go down? I mean, the whole healthcare system is complicated, and so if you want to keep certain parts of it, like no pre-existing conditions, and kids can stay on their parents' policies till they're 26, but take away the individual mandate, it just creates a lot of potential complication and chaos for the healthcare market. Now, if it's a showdown between the vision of a new health care law that the new president of the United States wants and that which is favored by more conservative House Republicans, my money would be on Trump because he just won the election, and I think that he might even be able to get some Democratic votes if he's going to preserve enough of the elements or principles of Obamacare that the Dems may say, well, this is better than nothing and better than we're going to get by just sitting back and letting Paul Ryan dictate the shape of new healthcare systems. So this is one of many battles that will be fought as you make the transition from campaigning to governing. Governing, of course, is going to involve some compromises, but Donald Trump, days before he is sworn into office, serving notice that he's not going to let 20 million people be kicked off the insurance rolls, and if that means he has to butt heads with his fellow Republicans, I think he's prepared to do that.